we're going to talk about the intersections of the LGBTQ community and the disability community today, and address some of the things that are common to the communities and possibly some differences that might come up. This dialogue between the two communities, as Garland would say, it's long overdue. And so, I'm really happy that we could do this. It's kind of interesting how it came up. I was at a sit-down dinner with Chicago Check, which is a research project on cancer, and I happened to sit by a person from Howard Brown Health Center. And we were talking about our work, and then we kind of hatched up this idea of having this encounter. So I hope everyone appreciates it. We know that there's many intersections and many forms of discrimination and oppression. It can be by age, by gender, by sexual orientation, by disability, by race, economic status. And, I don't know how many of those will come out today, but they're all really important. And a lot of times there's people face multiple barriers, I think, to their human rights and to having a decent way of life. And so we hope that we can address that a little bit and learn more from each other. I also just want to mention that July is Disability Pride Month, and the Disability Pride Parade will be Saturday. It marches from Plymouth Court and Van Buren to the Daly Plaza, and at noon there'll be tables and entertainment at Daly Plaza. So people are certainly invited to take part in that.
And there's Special Olympics too.
Oh yes, there's the Special Olympics at Soldier Field. That's a good thing to note. I also want to point out that the bathrooms are down the hall to the right. We have 2 PAs here currently. We may have a third one arrive. Can you raise your hands, the PAs? They're in that corner of the room. And if you need assistance, either get to them or send somebody to get them so that they can help, okay? And I just want to make sure everybody signs in so we have your contact information. And I would also like to introduce our facilitator for the day. It's Dr. Angel Love Miles, and she comes to us from as a postdoc from the University of Illinois, Chicago. And I met Angel at a conference on health disparities. She's done research on health disparities, and she's done research, I think, on housing disparities. And we're really happy that she's here today. And I also just want to note that while we probably won't get at the roots of all the problems we're facing, I think that we talk about a system of capitalism some people call neoliberalism, where most of the economic gains are going to the top 1%. And as long as that condition continues, we're going to see a lot of problems in people getting the services they need, in people being divided to fight for what I would call the scraps from the table all too often. And so somehow we have to address that. As the top 1% gets richer, really the rest of us get poorer, and that's not a sustainable situation. So anyway, here today, I'm glad to have Angel, and she will facilitate from this point on. Thank you.
Good afternoon, everyone. Thank you so much for having me. As Tom mentioned, my name is Dr. Angel Miles, and I'm going to be facilitating today. I'm so grateful to be, can you hear me? Hello? Oh, sorry about that. Okay, as I was saying, my name's Angel Miles, and I'll be facilitating today, and I'm really honored to be here as a member of the disability advocacy community in Chicago. Today we have a lot of wonderful speakers that we're really fortunate to hear from. Our first speaker will be Renee Luna, and Renee has become involved in the disability rights movement since the 1980s. Say hi to Renee. He's no. He has a long list. He has a long list of accomplishments and is no stranger to access living. He received his bachelor's in political science from DePaul University and was among one of the first people with physical disabilities to do so in the 1980s. He participated in many direct action events with ADAPT, including a famous event where he actually took a sledgehammer to the sidewalk to demonstrate the inaccessibility of the built environment. He's played an important organizing role in the passage of the Chicago Human Rights federal, state, and local policies, and he has filed numerous legal complaints to ensure equal access and disability rights enforcement. I really feel very privileged to be in his presence, and I know that we're all going to learn something wonderful from him, so please give him a round of applause.
All right, well, that's good that we're talking a little bit about history here, because that's the way I want to approach this. And Edwin mentioned the 1880s. He said I was born back then, or active. But that is important, though, because a lot of the discrimination that we face as people with disabilities goes back centuries. It's not necessarily a new thing. And there's always been hostility, and a lot of it is, as Tom said, class-based. And what do I mean by that? It's based on the fact that disabled people are seen as worthless and not contributing to a capitalist society. If you're not working, you're a drag on the society. You're taking from. And we've heard politicians say that recently, right?
Yes.
You're taking from the rest of us, as they say, or you're taking from the majority. And the fact is that disability can happen to anybody at any time. Obviously, when we're working, we can have accidents, and there are many people who do. Many people who go to war, they come back as disabled war vets. Many people crossing the street sometimes have an accident. I saw Kathy Powers on the way here. I don't know where she is, but she had an accident recently, and I did. So we never know when disability is going to hit us. We can be born with different types of disabilities as well. So disability is actually quite a normal thing, a common thing. But the way it's been portrayed throughout history is that disability is a deviance. Does anybody know what I mean by that? A deviance? It's a bad thing. It's out of the norm. And we kind of share that with the gay and lesbian community as well. Because if you look at some of the old social science books and psychology books, that's what they talked about. Deviance. If you weren't part of the norm, the social norm, you were outside of it. You were abnormal. Okay? So we share that in common. And when people try to label you as being abnormal, what happens? There's a lot of hatred and hostility. That's the way I think the discrimination comes out, both to the gay community and to disabled people. And for disabled people, on top of that, we add another four-letter word. Does anybody else know what that four-letter word is?
Hate.
What?
Hate.
Yeah. We used to do a Jerry Lewis telethon, and one of the slogans was, does anybody remember one of those slogans?
Piss on pity.
Piss on pity. Pity is a four-letter word. You know that? It's a four-letter word. And why is that a four-letter word? It's not the same as sympathy or empathy or compassion. People tend to think of it as that. But pity means that there's somebody above you looking down on you. And you've heard the religious saying, There for the grace of God go I. Have any of you heard that before?
Yes.
Well, think about that. There for the grace of God. That means God has saved me from becoming like that. Like that must be the worst thing in the world, to become disabled. That's what we're taught in society. That's where this idea of pity comes from. And people think pity is a good thing. But those of you who've experienced some of that paternalism, some of that condescension, know that pity is not a good thing. Raise your hand if you've ever faced paternalism. Yeah,
What's paternalism?
paternalism. That's kind of like, well, one way is when your parents look down at you as a child, even though you're 25 years old, right?
Oh, yes.
Okay? That's one way of looking at it. So when you get treated as a child, but really it's a sense of domination. What's behind it all? Domination. It's a hierarchy. One group feels higher or more privileged or better than another group.
Oh, yeah.
And they dominate that group. They make that other group inferior. And that's where the dynamics are. So, when we talk about how complex this is with capitalism and neoliberalism, it all fits in, because this is what the neoliberal mentality is about. That ideology of those being less than, or being unequal. Capitalism kind of depends on inequality based on wealth and income, but also social status, right? Disability, being gay or lesbian, being queer. All of these terms are very political terms. If you look at the history of it, the dominant class always needed to put a label on those that they wanted to oppress or they wanted to keep down. One of the things that we saw with the disability community, and we saw with the gay community, they took it to a different extreme. The oppressors took to another extreme back in the 1930s, particularly in an area of the world in Europe, in Germany, in Spain, and other areas where there was growing fascism, creeping fascism. Everybody know what I mean by fascism? Yeah, it's a system of oppression where the capitalist class, they take control and they dominate. You've heard of Hitler, you've heard of Mussolini, you've heard of Franco. Those sorts of systems, they're famous for being anti-working class and Trump, anti-working class, anti-communist. They're very reactionary. And reactionary, people are conservative, right? Republicans tend to say they're conservative. But they're more than conservative. They're reactionary. And what that means is they're reacting to our movements that are making gains, positive change in society. They want to take back. There's backlash. Have you heard the term backlash? They want to take back what's already been won by progressives, by those of us with disabilities, by the gay and lesbian community, by African Americans, by women. They want to take back some of our civil rights, some of the equality that we've gained. And one of the things that they did, and one of the things that we have to be fearful of, is the idea of eugenics. Does everybody know what eugenics is?
No.
Everybody kind of knows that there were concentration camps, there were gas chambers. Among those that died in the gas chambers, we all know, are, of course, Jews, but also disabled people, and also gay and lesbian people. Interestingly, the term back then wasn't gay and lesbian, it was more queer. right? So if you didn't act like a traditional macho male, you were queer. If you had some feminine traits to you, and you were a guy, you were queer. Or if you were a woman and you had some masculine traits to you, you were queer, right? So there was this hatred, this oppression. We don't tend to see that today anymore. Eugenics was about building a perfect class of people, mostly white, right? So race also entered into this. Race is another issue. This is a lot to talk about, and I'm giving you a big history lesson here. What I want to say is that we have won, and we can't let what's going on today keep us down or get us down. We have to fight back even more. In the 1980s, those of us in the disability community organized to get lifts on buses, right? Many of my brothers and sisters here, we were involved in that struggle. And it's not because the ADA gave us this right. Many people believe that. It's because we fought for it. We blocked the buses. We took over the CTA meetings. One important thing is we filed a legal complaint. So even before the ADA was passed, a judge in Illinois ruled that we have a right to equal access to public transportation. Okay, so everybody should know that. Everybody should know that. And that was a victory for the community, because now we see people riding the buses everywhere and the trains. And when we're visible, people know more about us. The changes in society, the culture, our communities. So it's not just about getting from point A to point B, but it's about opening opportunities and continuing on our struggle. Also in the 1980s, one of the things that happened, and I was happy to be involved with, was the passage of the Chicago Human Rights Ordinance. Do any of you know about that Human Rights Ordinance? Did you know that Chicago has a Human Rights Ordinance? Raise your hand. A few people do. You could have fooled you, yeah. You wouldn't know it if you hadn't heard it here first. I remember back at that time, leaders in the gay and lesbian community had been organizing. Do you remember Harold Washington, of course, great mayor? They went to the mayor and they said, we need a human rights ordinance to protect the rights of gay and lesbian people. Back in the 80s, what happened back in the 80s that really brought the gay community out in full force? Something very important. About and what? HIV and AIDS. That was very important. Remember a group called ACT UP? Fight Back? Yep. Well, that was very important. And that was, people realized that we needed a change in this city. And so leaders organized to get the passage of the Human Rights Ordinance. But when they counted the votes, they didn't have the votes in the city council. So they broadened their organizing techniques, and they reached out to other communities to form alliances with the Latino community, with the African American community, with the women's community, and with the disability community, and others. I don't want to leave anybody out. But they did approach us in the disability community. So I became involved in the passage of the Chicago Human Rights Ordinance. And when we had a press conference, the city council members at the time who were against the rights of gay and lesbian transgendered people, also they said, well, we'll give the handicapped their rights, but we won't give gay people their rights because it's immoral, it's against religion, and all you handicapped people, we'll take care of you. And you know what we said? No, we're in this together. We will not accept divide and conquer mentalities.
Yeah.
So we went to press conferences, and at one press conference, I remember a priest, I don't know what denomination he was from, but he came up to me and he says, "My son, you'll be damned for associating with sodomites." I said, "Thank you, Father. I'll be there with you." And so we won. We won again.
Yay.
Right? So the times in the 80s were very important. It brought communities together. And of course, the AIDS issue raised the whole issue of health care for everybody. What happened in 1990? Specifically,
The Americans with Disabilities Act.
the ADA was one. So this was a whole period of victories for the disability community and for progressives. And of course, we've had other victories along the way, and I think Sylvia's going to kind of bring us up to date on some of that. But I do want to say that the ADA, when you think about the ADA, does that affect health care?
Yeah.
Yes, right? What does the ADA basically do? Basically, it says, what does it do?
It gives us equal access.
It gives us equal access. It bars discrimination on the basis of disability, right? And it creates equal access. What would that mean in the area of healthcare? That means the facilities have to be accessible. Physical and programmatic accessibility. Actually, that was already required under another law that we helped to get. Does anybody have heard of Section 504?
Yes.
Yeah, Section 504 already required entities that received federal money to provide accessibility.
Would that be included public transit?
That became a difficult issue. I could give you a little bit of history about that, but I won't. The important thing is that how many of you ever been to a hospital that's accessible? Fully.
No, is that full?
Fully.
Brand new, no.
No. And I don't mean just physical access. I mean total access for people who are deaf. Do they have sign language interpreters?
No.
Not always. Is there information in Braille? Not always.
Attitudes can be bad.
Prejudices, discrimination, attitudes. What's one of the biggest attitudes?
We don't have that.
Yeah, well, they want to look down at you, right? They're the bosses. This is the medical model. So we have to be careful with the medical model. It can be a barrier. And I think Sylvia's going to talk about how we've changed towards patient-centered services. And that's going to be another victory for the disability community, actually. So getting those tables, women, when you have to have a breast exam, right? You need to have an accessible table. If you're in a chair, are you going to be able to get up there? No. A lot of times you have to get transferred into a bed or something. Do they have the Hoyer lifts? Do they need? No. They have. Yeah, they don't use them. If they have them, they don't even know how. Okay. Should I take questions?
No, but repeat her comment.
Oh, okay. Go ahead.
I was just gonna say, look at Northwestern. I mean, theirs is good, but the beds are unsafe there too.
Yeah. I'll tell you, Northwestern's an interesting point. They've improved. But you know why they've improved? They've had complaints filed against them. That's exactly. Did you hear what Kathy said? You want to get anything, you have to sue them. That's exactly the point. If we don't enforce the ADA, if we don't file complaints, the ADA is not going to help. Okay? And I don't know how many minutes I have left. What's
Yeah.
5? Okay. Sounds like an extension, but okay.
I mean, you can end it early if
Okay.
you like, however
All right,
much you want.
so that's an important thing. Keeping the facilities, the healthcare providers in line and saying that we are equal partners. We are equal partners in health, the provision of healthcare. And we demand equal access, whether it's physical or for people who are deaf, having interpreters, or people who are blind, or other disabilities. You know, not everybody's in a chair. People have hidden disabilities, or what we call non-visible disabilities. We can't neglect that. Some people have dyslexia and can't read. And there's an assumption that if you can't read, you must be dumb. I know, isn't that one of the most terrible stereotypes too?
Yes.
And what happens? We talked about paternalism. Sometimes even within our own family doesn't understand our disabilities. Isn't that in common with the gay and lesbian community?
Yes.
You're usually someone who's gay or lesbian or transgendered is being raised by parents who aren't themselves gay, lesbian, or transgendered, usually. And so they don't understand what it's like. Sometimes parents don't understand what it's like. Or your partner doesn't understand what it's like, right? So we have to change these mentalities that Tom talked about within the healthcare arena itself. Saying you're an equal partner. Don't let yourself be talked down to. Okay, that's one of the other things. So these are two of the biggest barriers inside of the healthcare field itself. But I want to think about disability in a more broader sense. It's not just, healthcare is not, we're not all about our health issues, our medical conditions. That's not what disability is about. Disability is really a social condition. Right? People understand that?
Quality of life.
In a medical model, you're defined as having a disability because of the limitations you have. Right? The specific diagnosis that you might have. And that diagnosis tends to be a label and a stereotype. Because somebody says quadriplegic, there's an assumption about what a quadriplegic is or isn't, what they can or they can't do. Right? So, any of you know anybody who's quad?
Yes.
That's a pretty broad range, right? I mean, you could see people who are quad, even pushing their chairs, have use of their hands, maybe sometimes even stand up. And with the way the wheelchairs are now, they could stand up anyway, right? With the motorized chairs or the rising chairs.
If you
So-
can convince the insurance company.
If you can afford those things. Okay. So that
Universal health care.
so this is the
Right.
so this is the other thing is we face this backlash. I think we mentioned Medicare and Medicaid. What will solve that problem?
Single payer.
Single payer.
Call the
That means we won't be all divided. We won't all be divided. Single payer will provide health care for everybody. And it will bring the costs down. Right now, part of the reason why the costs are so high is because the insurance companies want to make profit. Remember Sarah Palin? She talked about death squads. Well, there's already death squads, even under the private insurance companies. They get to determine who gets what. Yeah, and many of you, unfortunately, have experienced it. And you could tell me the horror stories. I don't need to tell you. That's the thing. And when it comes to this arena, there's no bigger, better expert than you. And you got to get that in your head. We have to be partners with those doctors and professionals who think they know it all, but we have to remind them that we are equal partners in healthcare. I also wanted to talk about community because I think community is important. In our neighborhoods, we have to fight for accessibility. We have to be more visible. Sometimes people get very isolated. And when you become isolated, you tend towards depression. And we tend to think of depression as an individual problem. Mental health issues are individual problems. They're not. They're social. They're social problems. They're cultural. We can alleviate some of these things before things get really out of hand, before somebody becomes suicidal. If we could develop the infrastructures, the support systems that we need. So that's some of the things we need to work on. Working and changing our society, changing our culture, forming community. And I don't mean just coming to Access Living to form your community. I mean getting involved in your local neighborhood on local issues like housing, accessible, affordable, and integrated housing, jobs, not just jobs for non-disabled, but for disabled, and for gay and lesbian people as well, and for youth, for young people. We could develop programs and partnerships where we all work together. There are laws, but they don't help unless we help to create the change. But we have to become informed and educated ourselves, okay? And I'm wrapping it up because time's up.
Thank
Act
you.
up. All right, thank you.
Thank you so much, Renee, for your words of wisdom and your introspection. We're moving on now to Sylvia Rosenkalk. Did I pronounce your name right?
Sylvie Rosenkalk.
Oh, Sylvie Rosenkalk. Okay, great. Sorry. I apologize. I forgot to mention that my preferred pronouns are she, her, and hers. And so sometimes it's helpful to be inclusive when you're thinking about gender identity to mention what your pronouns are. And so those are my preferences. And Sylvie says that her preferences are she, hers, and hers as well. She is a Boston native with a passion for popular education. She holds a BA in Comparative American Studies with a concentration in histories and practices of social change from Oberlin College. She currently splits her time between the education and the aging services programs at Howard Brown Health Center, a network of community health clinics focused on ending health disparities faced by the LGBTQ communities. At Howard Brown, Sylvie has helped to start a peer-to-peer advanced care planning clinic and has worked to transition Howard Brown curriculum from a cultural competence model to a critical consciousness model. Please welcome Sylvie Rosenkalk.
Yeah.
There was a new vernacular introduced, the she, he, and her. Can you give us a definition of that so we're all on the same page? Because I don't know what that is.
Okay, Sylvie, do you want to give
Sure.
more explanation for that?
Sure. I can give a brief explanation. Let me just get settled here and make sure all my ergonomics are in the right place. Well, I'm a little person, so it fits for me. I'm good. Thank you. Hi, everyone. My name is Sylvie Rosenkalk, and I use the pronouns she, her, and hers. And we just had a question about why I would say that or what that means. One thing when we talk about accessibility and universal access is thinking of access beyond just our physical disabilities and limitations and functions, but also thinking about our identities, including our gender identity. So saying my pronouns out loud is a way that I show respect to my trans brothers and sisters and non-binary siblings who have to state out loud what their gender pronouns are so that people can refer to them respectfully. So at Howard Brown, we have a culture of we all introduce ourselves with our pronouns, so nobody is necessarily singled out by expressing the way that they want to be referred to. So all that means is that if I'm not in the room and you're talking about me, to please use she when referring to me. That's how I identify. Does that make sense? Are there further questions about pronouns? Now, I do a 2-hour training about pronouns at work, so I could certainly go into it a lot more. Thank you so much for having me here. I am supremely excited to be invited as a queer and disabled person to this town hall. And I'm not going to ask you all to out yourselves, but I'm hoping that there are some other queer disabled folks in the room as well. So I was very lucky, I feel, to have been brought into consciousness around disability and my identity as a disabled person by a group of queer people. And I was introduced to a movement called the Disability Justice Movement. Who here has heard of the Disability Justice Movement? Yeah, great. So disability justice was, or is, a movement ongoing that started, or the term was coined in 2005. So thank you, Renee, for bringing us all that history up until, and I'm going to sort of talk about what's happened in the 2000s. And the disability justice movement was thought of as an answer to a lot of the intersections of oppression that we've already been talking about. So a lot of queer folks who were involved in disability rights organizing felt as though their whole selves, their whole sexualities weren't necessarily being respected or centered. Their issues that they wanted to fight for not necessarily being centered in the disability rights movement, and experiencing a lot of ableism within queer organizing and the gay and lesbian rights movements. These are also primarily a group of people of color who were directly responding to racism that they had experienced within the disability rights movement. And a group of folks came together and started talking about, what could we hear in the feminist movement, first wave, second wave. So they were thinking, what would like a second wave of disability organizing look like? And they started organizing together, and from 2005 until 2015, a couple years ago, this same group of people published their 10 principles of disability justice and a sort of a manifesto of what the movement stands for. And what it really stands for, I think, is everything. And I know that sounds a little overwhelming, but I think universal, exactly. And going really beyond what we could even believe is possible right now, and having the bravery to dream of a future free from capitalism, free from racism, free from heterosexism, free from gender, free from ableism, with true universal access and true radical love, meaning that everybody in their bodies are valued as whole human beings with decency and, things to share with the world. So a couple things that stand out to me about this queer disabled-led movement. One thing we've already talked about is direct action. Renee spoke a little bit about the AIDS epidemic in the 1980s and the effect that had on the gay community. And one thing that people may or may not know is that before that moment, within the gay male community, so I'm going to be specific here, there was not much of a focus on organizing around healthcare. There was, amongst some lesbian organizations, a focus on healthcare. After and during the AIDS epidemic, the whole community was really emboldened to demand quality healthcare because we were dying. It was as simple as that. And people got expressly political. You've heard of ACT UP. You've heard, we just talked about this, so I don't need to go over it again. But the idea that decent health care, quality health care, is a political issue to be demanded, that was sort of a novel concept. And I want us to remember in this day and age, as we're fighting all this legislation, all the cuts and rollbacks and everything going on in the political arena, that our right to quality health care is something that we have to fight for. And so when I talk about quality health care, I'm going to talk a little bit about my workplace now for a minute. As a disabled person who's been repeatedly traumatized in healthcare environments, never did I ever think I would be working at a doctor's office. But here I am. I work at a doctor's clinic. And I want to explain to you how I made that feel okay for me and why I feel good working at Howard Brown. Howard Brown is a community health clinic. We're a federally qualified healthcare center, which means in legal jargon that we specialize in treating people who are uninsured or underinsured. This means that nobody is turned away at any of our health clinics for lack of ability to pay. That's huge. Yeah. And yes, question. We have 9 clinics located throughout Chicago right now, from the far north side, Rogers Park, down to 63rd Street in Englewood. There's a brochure at the table that has all of the clinic locations. And feel free to, ask afterwards. Now, another thing that we talk about a lot at Howard Brown is we have 2 sort of phrases that we throw around a lot. One is trauma-informed care, and the other is person-centered care. So any guesses for what trauma-informed care means?
Gunshots.
Gunshots? Okay, so thinking about trauma that other people have experienced. Any other ideas?
Head trauma.
Head trauma?
Rape.
Rape? Yes. Sexual assault. So we're naming right now lots of different types of trauma that people can experience. And we know that the LGBTQ community, the queer community, and the disabled community both have experienced disproportionate amounts of sexual violence and of interpersonal violence and other kinds of violence. I see a lot of hands. I'm going to keep going, and I'll have a time for questions at the end. So another kind of trauma that I mentioned briefly that I'm sure folks in this room have experienced, medical trauma. So has anyone here ever felt violated as a human being because of an interaction they had in the medical system? Yeah.
I got 2 hands raised.
Yeah, okay. And so we know that at Howard Brown. And we want to make sure that our site where we work is not going to be a place where you come in and experience more trauma. Trauma-informed care means that we assume that everyone who is walking in the door has experienced trauma, and we're going to do our best to meet them where they're at and to not inflict further trauma. This means things like we do a lot of sexual health testing. If you have to do a swab, like a vaginal or an anal swab, at our centers, we help you do it to your own body. That's an innovative thing that I have not seen at another clinic. Of course, if that's not something you feel comfortable or don't want to do, our practitioners are more than happy to administer the test for you, but it is your choice to administer the test to your own body first. There's a lot of other things like that that have made my experience as a patient at Howard Brown really quite different from any other medical treatment I've ever received. So, we're talking a lot about bodily autonomy. This is my body. I can do what I want with it. That's one of the frameworks of queer organizing, and that's one of the frameworks of disability organizing. Another thing, we're talking about being anti-assimilationist. So what I mean by that is back to what Renee started out talking about deviance. We are embracing the deviance. We're saying, yeah, we're not like you. And that's a good thing. We see a lot of problems with the way that the society has been running. And we have created innovative ways within our own communities to get things done, and those deserve as much respect. So something like in LGBT communities, we talk about chosen family. So these are your family, the people that take care of you, who you can go to in the middle of the night when you need support. Who's gonna, sit with you while you're waiting in the doctor's office? Who's gonna take your dog for a walk when you can't get out of bed that day? Who's gonna, just talk to you after a hard day and vent to each other? A lot of queer people have been thrown out of our biological families of origin over time. And that's a painful fact. But it's made an amazing, we have adapted. We have been resilient. We've created a new way to take care of each other. And this is by choosing our family, and by saying, I'm giving you these rights. And that's why I mentioned in my bio the advanced care planning clinic that I've been working on. And who here is familiar with advanced care planning or knows what I'm talking about? Okay, cool. So in general, we're talking about thinking about what you would want, the choices that you would want to be made for your body in a case that you're not able to communicate those decisions. So it could be that you are temporarily unconscious, or it could be that you're reaching end of life, or any number of things. Now, an advanced care planning document is where you would write down all the things that you want to happen to your body and the way that you want your care to go. And one important thing, this is how it relates to chosen family, is that in the legislation right now, if you don't have this document and you're unable to communicate your needs, the person legally who's responsible that the state decides, number one, are there any guesses?
Your family.
So number one is your spouse, your legal spouse. So that means if you're legally married. Right, I know, I'm with you. Number two, if that person is unavailable or you don't have a legal spouse, it goes then to your biological parents. Then it goes to your biological children. Then it goes to biological grandchildren, and then to biological relatives. Now, for a lot of people in the LGBT community, those are not the people we want to be making decisions about our health care, especially people who may have denied our humanity, and especially in the case with our trans comrades. There are even cases of people being misgendered and disrespected in their death, and we're trying, to avoid that. So an advanced care planning document, the really snazzy thing about this legal form is that you can choose whoever you want in the world to make that decision for you if you write it down and you sign it and you have someone sign it. So what we're trying to do at Howard Brown is create a peer-to-peer network of older LGBT adults who are helping each other fill out these documents, who are helping each other, give legal rights to their chosen family. And that's the kind of innovative thing that can happen when, 1 minute, thank you, when queer ideas about family and care and chosen family mix with the disabled ideas of I'm in charge of my own body, I get to make the decisions, and a peer-to-peer as opposed to a medical top-down interaction. So I'm going to end there for now. Thank you for listening.